So we need to be more authentic with each other.
Whole life, physically, mentally, and spiritually.
Christ, Jesus, the great physician. And he was healed, and now
It's really time to reconnect with your family.
All about life, health, and healing hope.
Thanks for joining us for this edition of Healing Hope from the Kettering Health Network. Today our guest is Dr. Brian Schwartz. He'll be sharing with us the transformation that occurred in his medical practice when he began praying with his patients. And later on, we'll have some important information about avoiding E. coli infections. But first, here's Lonnie Melashenko and Dr. Becky Wong.
Welcome again to Healing Hope. We're delighted you joined us today. And my co-host, Dr. Rebecca Wong, thank you for joining us.
Great to be here, Lonnie.
Now, we also have a special guest today, Dr. Brian Schwartz, who is an interventional cardiologist. What is the difference between an interventional cardiologist and, say, a heart surgeon?
Lonnie, it's a great question, and there is actually a huge difference. Interventional cardiology has been around probably about 25 years, but it's only in the last decade that they have started doing a lot more, to the point that cardiac surgery in this country has gone down. Because what the interventional cardiologist is a cardiologist who has an internal medicine training for 3 years and then has another 3 years of cardiology, but they go beyond the regular cardiologist to do another 2 or 3 years where they are specially trained in doing heart catheterizations, or angiograms as we call them, where they thread a catheter into the arteries of your heart and inject dye, and when they see blockage, they either open up a little balloon that helps expand the narrowed artery, or they put in a stent, a little straw that opens the blood flow. And by doing that, then the patient doesn't have to have their chest cracked open and have the bypass done. And not only does Dr. Schwartz do the heart, he also opens up the carotid arteries to prevent stroke, and the arteries that go to your legs, like if someone suddenly comes in with blockage in the artery and their foot is cold, instead of having the patient lose their foot and amputate it, he can open up that artery right away. It's really quite wonderful.
Amazing. Now, we get into the area of wellness of a person and their spiritual temperament, and people today are having trouble with patience. There's so much stress. How does that affect one's heart? How does anger and rage work into this?
You're bringing up a very good point, Lonnie, because I think most people in our audience know that if your cholesterol is high and your blood pressure is high and you smoke and you have a strong family history, let's say your dad and your older brother all had heart attacks when they were in their 50s, and you gain a lot of weight and you never exercise, people know that that's all bad for your heart.
You're a prime subject.
Absolutely. But you know what a lot of people don't know is that in addition to your beat heart, the heart and the mind and the seat of your emotions can make a huge difference. Now, for example, let's say this lion would run into the room right now, or worse, a man with a gun.
Yes.
What would your reaction be?
Fear.
Yeah.
I'd want to get out of here.
You'd have fear, and that triggers adrenaline. You know, adrenaline can make your heart beat faster, pump harder, and the heart muscle will be stressed by the adrenaline so that it wants to pump more blood into your heart quickly. And if there's blockage, then that amount of stress can precipitate a heart attack. Or let's just take even low-level stress. Air traffic controller. Very stressful job because they're always watching these planes come in and have to coordinate all that. People like that who are under chronic stress, you can actually measure that in their saliva, and they have higher cortisol levels. Now, cortisol is a hormone that is also higher in college kids before they have an exam. So, you know, a busy executive or a busy pastor who's always on the go and never has any downtime to just relax, be with his family, these people are at prime risk for heart attack. People don't realize that our emotions can really cause our vessels to spasm. So the artery may not even have blockage in it. They could be clean, like I hope our arteries are right here. But if you get stressed enough, just like when you're nervous about giving a talk, your hands get cold, that's because the arteries are shutting down. And if the artery shuts down in your heart, you can have a heart attack. So people who have high levels of stress all the time because of their job or a bad marriage or just lack of connection with God and with people, they are at high risk for heart attack. They may be thin, have low cholesterol, they may be exercise, but if their heart isn't right, they can have a heart attack.
I once met the famous painter of light, Thomas Kincaid, and he once said that our lives were meant for calm, not fear and stress.
Well, God created us to really live the abundant life, as Jesus said. I mean, Jesus is the Prince of Peace. And in a world where we worry about terrorists, we worry about how we're going to pay our mortgage on the home, we need more than ever to have that calm, to have that trust and that peace. Because otherwise, you know, it's not only our heart that suffers, it's our whole well-being, mentally, spiritually, and physically, that's really at jeopardy.
So where do we go from here?
Well, that's a great question, Lonnie. On the one hand, we have patients. When they were surveyed, 80% of them said they would welcome their physicians praying with them. But on the other hand, when physicians have been surveyed, even Christian physicians, fewer than 1% say that they routinely pray with their patients.
Wow.
So patients want it, and doctors are either uncomfortable or afraid to do it. So I'm really excited because Dr. Brian Schwartz does this routinely. So I want to hear what he has to say about praying with his patients.
Dr. Brian Schwartz, thank you so much for joining us here on Healing Hope.
Well, thank you very much for having me.
Now here we talk a lot about faith and medicine and how faith actually improves the healing process in medicine and improves your health. For you, was your decision to become a physician somehow tied to your faith as a Christian?
Yeah, absolutely. When I was most attracted to medicine, it was part of trying to do a ministry of some sort to reach people, to be of service. In fact, I had originally thought of actually going overseas to be a missionary doctor.
Interesting. Now, our topic today is praying with patients.
Yes.
Has that always been a part of your medical practice?
No, it actually hasn't. I can remember as a medical student one time having a faculty member encourage me to pray with a patient, and by the time I got in there, the gentleman was very hard of hearing. I couldn't remember his name. I was screaming at the top of my lungs and thinking, this isn't going very well, and I just didn't feel comfortable with it. I felt like I ought to know how to do it. I knew of a few physicians that did incorporate that into their practice, but it just wasn't modeled to me in a regular way that I felt like I could just pick up and be comfortable with.
Now, more and more in recent years, articles are coming out about the importance of faith and particularly prayer. Was there a particular event that really got you to thinking about the importance of prayer in your medical practice with your patients?
Now, about 5 years ago, I started thinking about my practice. It was, in my mind, a job that I did, the way I made a living. I went off on mission trips to Africa and other parts of the world. That was my mission. I was involved with my church. I was teaching classes and doing Bible studies at home and at the church and various places, but I thought of medicine as my job. There was almost this feeling that if I talked about spiritual things with patients, I might be violating their ethics.
Medicine was over here, but spirituality's over here.
It was, but I knew it just didn't fit quite right. I wanted something more. I just didn't know how to quite do the next step.
Well, what triggered the next step?
Yeah, a couple things happened actually. One, I went to a conference of actually the very first conference of a group of physicians that kind of felt the same way, didn't know what the next step should be, but got together to encourage each other. And actually, Pastor Mark Finley was there and gave us some actual specific advice as to how we could implement this into our practice. But I was convicted with, in particular, with one patient that I had. I was taking care of a lady who was actually in the heart cath lab having a heart attack. As I engaged the catheter into the main coronary artery, the left main artery that we call the widowmaker.
Widowmaker, this is serious.
She had a very serious lesion. Just by putting that catheter in, even before I took a picture, the blood pressure just bombed down, and just that tiny little catheter in there, she couldn't tolerate. So we knew we had a very serious lesion that was going to need to be treated in the operating room with open heart surgery. It was going to entail more than what we would typically do with just a catheter.
And time was a factor. It was ticking.
Time was important. She had to get moving. The whole operating room staff came in and was rushing around her to get her off to the operating room. But an anesthesiologist that was going to be taking care of her came in and out of the blue just said, "Everybody, can I have you just pause for a moment? I'm going to have a prayer with her."
Wow. What was the reaction?
Well, I was convicted immediately, thinking, I should have been the one to do that.
Wow.
But I didn't know how. So I listened to him. I was also impressed that afterwards, the cath lab staff that I work with were talking about it, thinking, wow, that was really neat. Nobody ever does that. And I felt convicted right then and there that, I need to learn how to do this and implement that into my practice.
So that was the opening of the door for you.
That pushed me over the edge, and I started trying to pick out a few patients that I thought would be receptive to it to try to offer to have a prayer with. Before long, that was received so well by my patients. Many of them would just get tears in their eyes and say that no doctor's ever done that before, and just thank me. That would open up the possibility to have other conversations, other spiritual conversations. They couldn't thank me enough. I now offer to pray with every one of my patients.
We'll have more with Dr. Brian Schwartz after this brief break.
Over a century ago, a brilliant young Dayton inventor had a vision for the future.
By itself! This Kettering guy just might change the world.
Today, that same spirit lives on at the Kettering Medical Center Network, bringing the best in medical technology from around the world home to Dayton. With that kind of vision for the future, what might tomorrow bring?
Those guys just might change the world.
You can only imagine. The Kettering Network, for life.
If I'm going to be a healthcare provider and if people are going to come to me and trust me, then I want to give them the best care that I possibly can.
I love it. It's great. The classroom sizes are awesome. You get that personal one-on-one time, even in class.
They taught well, and I learned well, and they really, truly cared.
The philosophy of Kettering College of Medical Arts is such that our view of who we are as people means that when we care for others, we are doing the work of God. We are God's hands.
It was just so surreal to me because I didn't ever think I had a heart problem. Here I was 47, and they said that, I probably had about a 1% chance of making it. And I did. Kettering is known as the heart hospital, and when I see Kettering, I think that's where I got my second chance, and it feels like home.
For more of the story, go to experiencekettering.com. Kettering, for life.
I knew it was serious the whole time, but it was still just unreal, and you never really soaked it in. So I was hearing all this stuff, and it sounded really bad. You can't even tell that she went through such a crisis because she's back to normal, and they said she'll eventually feel better than she did before. So I don't think they realized that they not only saved my mom, but it helped save my family.
For more of the story, go to experiencekettering.com. Kettering, for life.
Now we rejoin Lonnie Melashenko and Dr. Brian Schwartz as they discuss praying with patients.
Now, has prayer opened other conversations with people?
It's been amazing. Just having a spiritual conversation at all with a patient often gets to the root of some of the problems that they have. Things like depression and poor self-image often result in excessive eating, not exercising, just not feeling any motivation to make lifestyle changes.
In other words, spiritual issues can affect people's health care issues
Absolutely.
directly.
So if I start addressing those, they start finding a hope, a power to make a change in their life that they didn't know they had. Once they understand that, God's going to help me stop smoking, it becomes a lot easier to stop smoking. And it really does seem that once I've incorporated this into my practice, patients were making changes far more than what was happening before.
And in many ways, this profoundly affects the patient even more than the actual medicine that you prescribe in many cases.
Yeah, I think it has a very profound impact. I can tell you some interesting stories. When I first started doing this, I'd pray with certain patients, and before long, if I forgot who I prayed with, they'd come back and say, well, aren't you going to pray with me?
Wow, the word got out.
One lady in particular who was an elder in her church came back the next visit and said, I got up and testified, you're going to be having some patients coming. And she brought her daughter, who was only in her 20s, to come and see me. So I walked in the room, I recognized my patient, and I saw this young lady in her 20s sitting up on the table, and I said, oh, aren't you supposed to be up here? And she says, oh no, I brought her. I want her to see you. And so I started taking a history. I said, well, what heart problems have you had? Oh, she hasn't had any heart problems. I just wanted her to have a doctor who prayed with her.
Wow.
And it was just really contagious and very powerful.
Well, now that prayer is a part of your regular practice, do you hear stories about what patients say when you aren't even around? What do they say about this?
Well, I know they go back to their churches and talk to other patients. I have patients that drive up from Kentucky and from Cincinnati just because other patients have told them that I pray with them. So the word is getting out. I've gone in to pray with my patients in the pre-op area, the area that we get patients ready for a procedure. And another doctor's patient will stop me and say, well, can you pray with me too? And that's been very interesting. One time I was out of town and my partner was going to do a procedure on one of my patients who was used to me being there and used to me praying with them. And they said, well, I don't want to go have the procedure unless somebody prays with me. And two of the girls that work in the cath lab with me on a regular basis said, we can pray with you. And they were thinking real hard, well, what does Dr. Schwartz say? And how do we do this? And it was just a very powerful experience for all of them to go ahead and do that.
Wow.
I do truly believe that this has a power, a calming influence on patients. I believe it gives me greater confidence and greater skill. I ask God to be with me and guide my hands, and I believe that He truly does. I believe that there are some studies that show that patients that are prayed over have less rates of infection, they leave the hospital sooner, even if they don't know they're being prayed for. I don't know how that works, but I do believe that there's power in prayer.
Well, then what advice would you give doctors or other health professionals about praying with their patients?
Based on my own experience, I think patients are very open to the idea. So we shouldn't have to fear that. I would not coerce my point of view on a patient. I always offer to pray with them. I offer to have a spiritual conversation. I don't force it. And I would just say, try it. I think you'd have a very good experience. I've shared this testimony at meetings with other physicians and had dozens actually come up to me afterwards or see me a year later even and say, you know, because of that testimony, I've gone back to my practice and tried that. I've sometimes thought, well, yeah, I'm in Ohio, I'm in the Bible Belt, it's probably well received here. But these are doctors from all over the country, and I'm no longer just doing a job. I feel like I am being Jesus' hands, that I am truly doing ministry.
Marvelous. Now, you're involved in an organization called AMEN, A-M-E-N. That's an acronym. Tell us about that.
Yeah, that stands for the Adventist Medical Evangelism Network. It got started about 5 years ago with just 20 or 15 to 20 physicians and dentists, but with the goal of encouraging each other through a journal, through programs such as this, through workshops, and through a national conference that's held once a year in October, to do exactly what we've been describing, to see our practices as not just a job. This isn't just a profession, but to learn how to make it into a ministry. So AMEN is involved with doing mission projects around the world, but also involved with local churches with evangelism, and also even making a medical practice a means of reaching out to people who are hurting and looking for answers.
Dr. Brian Schwartz, talking about trust in divine power. Thank you for joining us today on Healing Hope.
Well, thank you. It's been a privilege to be here.
If you'd like to know more about the Adventist Medical Evangelism Network that Dr. Schwartz mentioned, check out their website at amensda.org.
They actually do care about your progress. I know, when I heard that I said, yeah, okay, you know, you hear that from a lot of schools. No, really, we do care about your success.
When I go home, I talk about Kettering because I've had such a great experience here.
If you have a commitment to going into healthcare, you're going to get there in a setting where you know your fellow students and where you know your teachers, and it's going to make you someone who I think is going to be really highly valued in the workplace.
Never again just take anything, the perfect pregnancy, for granted, because you just never know. We were 4 weeks to the day early. I immediately was just like, we can't do this. We're not ready, you know, he's not ready. The special attention there was from the get-go. And so I knew he was going to be in good hands because it was their child, in the sense that the comfort was just there.
For more of the story, go to experiencekettering.com.
He smiles all the time. He's just, you know, thriving. Loves his mommy and daddy.
It was just so surreal to me because I didn't ever think I had a heart problem. You know, here I was 47 and they said that, you know, I probably had about a 1% chance of making it. And I did. Kettering is known as the heart hospital, and when I see Kettering, I think that's where I got my second chance, and it feels like home.
For more of the story, go to experiencekettering.com. Kettering, for life.
I knew it was serious the whole time, but it was still just unreal, and you never really soaked it in. So I was hearing all this stuff, and it sounded really bad. You can't even tell that she went through such a crisis because she's back to normal, and they said she'll eventually feel better than she did before. So I don't think they realized that they not only saved my mom, but it helped save my family.
For more of the story, go to experiencekettering.com. Kettering, for life.
Lately, it seems that E. coli outbreaks are in the news every few months, usually due to contaminated or undercooked meat of some sort. What exactly is E. coli, and how can you avoid it? E. coli is a bacteria that lives in the digestive tracts of all humans and some animals. Most strains of E. coli are harmless, but some strains can cause extreme abdominal discomfort, diarrhea, bloody stools, and vomiting. The OH-157 outbreaks in the U.S. have been traced to contaminated red meat. Cattle have higher levels of E. coli now since they are more likely to be corn-fed rather than grass-fed. So if you choose to eat meat, you must be sure to heat it to at least 160 degrees Fahrenheit, or the bacteria can survive and infect you. Vegetarians, however, are not immune either, because fecal contamination of vegetables such as lettuce and spinach have occurred. So be sure you thoroughly wash fruits and veggies before preparing them. Uncooked or unpasteurized foods such as dairy products are particularly dangerous. In other words, if you like the taste of cookie dough, do not lick the spoon or eat the dough till it's baked. If you're traveling overseas, you have to be very careful about the water. Taking along Pepto-Bismol tablets can actually treat simple E. coli diarrhea, or turista as it's often called, as effectively as antibiotics. But no matter where you are, avoid swallowing lake or pool water in order to keep yourself safe. A few E. coli scares have been traced to restaurant employees who didn't wash their hands with soap and water after using the bathroom. Because of that, all restaurant bathrooms now have signs that mandate that all employees thoroughly wash their hands before returning to work. In a healthy person, treatment for E. coli involves rest and staying hydrated. Symptoms of cramping and diarrhea usually clear up in less than a week. Most people just assume they have a stomach bug and don't even know that they have E. coli, so they don't go see a doctor. That's fine. But if you have bloody stool or high fever, you should contact your physician right away. This is especially important for young children, the elderly, and those with compromised immune systems or underlying health problems, because they are the people most at risk for serious complications. So be sure to wash your hands. It's the best way to prevent the spreading of all kinds of infections. Wash your raw food well. And if you choose to eat meat, cook it all the way through. For Healing Hope, I'm Dr. Becky Wong.
It is human nature to go it alone. But you know, trust in God works like a gyroscope, even for busy cardiologists and surgeons. It keeps you stable, even if life places you at a precarious angle. Trust in God inwardly is like that. We remain centered and stable, no matter how our outer world is spinning. It's been said that courage is simply fear that has said its prayers. When I'm all alone in the world, I can feel a little frightened. But with God by my side, I have courage to face the future. A scientific study of 560 households revealed that people who pray to a God they know intimately are happier, more satisfied, and enjoy a deeper sense of well-being about the direction their lives are taking. In addition, they experience significantly less physical illness and mental symptoms of stress and disease. The scientific data is growing. In fact, Georgetown University Medical School professor Dale Matthews and his colleagues have shown that religious involvement helps people avoid illness, recover from it more quickly, and most remarkably, they live longer. You see, the more spiritually committed you are, the more you benefit. Medical internist Larry Dawsey and others have published extensively on the benefits of prayer and healing. So undeniably, the medical community has a growing respect for the role that faith and prayer play in our overall well-being. In surgery wards, those who are fearful of the ultimate outcome have more difficulty focusing on recovery. But faith and prayer helps people marshal the resources that contribute to their healing in ways that others aren't able to do. Trust in divine power is a pathway to optimal health, physically and mentally. Oh, by the way, that medical advice, well, it comes straight from the words of Jesus, the great physician. Your faith has made you whole. And as our guest, Dr. Schwartz, discovered, friend, prayer puts both patients and medical teams at ease. Reminds me of this simple truth. Those who in everything make God first and best are the happiest people in the world. Thanks for joining us. For Kettering Health Network, I'm Lonnie Melashenko.